As Seth stated, I'm Elizabeth Seitz with CQL, and I have with me today Catherine Dunbar.
Hello, everyone.
And today we're talking about building solid systems for improving quality. So as always, we like to start by sharing our vision, which is a world of dignity, opportunity, and community for all people. Along with that, as always, is our mission statement, which is that we are dedicated to the definition, the measurement, and the improvement of personal quality of life. To date, over 400 organizations have achieved accreditation with CQL. This includes organizations throughout 24 of the United States, the state of Tennessee's Intellectual and Developmental Disability System, Canada, and Ireland. There are many benefits of accreditation with CQL. Most importantly is, of course, the positive impact on people and improved services. But CQL accreditation can also assist with strategic planning, accountability for ongoing progress, and data collection. Additionally, with accreditation, an organization gets external validation of the work it is doing, receives shared resources, and support for the use of the personal outcome measures, among other things, as shown on this slide. So let's start the systems conversation by, first of all, defining it. Now, here is one way to think about a system and, of course, how it is related to practice, which is important because a system provides structure for organizational practice. Now, on this slide, the train tracks are the system that you have in place to lay the foundation for your practices in providing supports and services. So the train, okay, or the practice and implementation of the systems uses the tracks or the systems developed by the organization. And in order for the train to run as it should, the tracks need to be solid. They need to have a destination or a purpose and have to be maintained regularly. Okay, solid organizational systems must, number one, be robust. Everyone knows this is a term CQL loves, but it's because it's what we look for, one of the things when we talk about systems. A robust system is not piecemeal or cobbled together. It is strongly constructed. There is no doubt about what the system is meant to do and how it is to be implemented. Within services, a strong system is fluid between people, services, locations, departments, and time. Now, another part of being robust is that a system must be capable of performing without failure under a wide range of conditions. Think back to our tracks and our train on the previous slide. The tracks must be constructed in a way that withstands all type of weather. And when we think about the weather that providers go through, you can think of things like organizational leadership changes, service additions. You can think about a pandemic. There are lots of things that can happen that a system, a robust one, must withstand. Second, a system must be sustainable. Now, a sustainable system, okay, like a tree, stands the test of time through any kind of change. Change in people, change in size, change in structure, change in requirements, which could be national or local requirements. And most importantly, change in requirements and the expectations of the people receiving services. A solid system can withstand disruption and still keep going. Think of it as the difference in a sprint versus running a marathon. A strong system is built for a marathon, not the 100-meter dash.
Systems also should be reliable. consistently good, consistently put into practice, able to be trusted. The one thing that we come in contact with very, very frequently when reviewing systems is that they often live in someone's head or they rely just on one person. So an example of this would be, if you were the person at your organization that maintained all the quality systems and you kind of did that on your own, all that stuff may live in your head because nobody else understands or does what you do. So you want to make sure that your systems can be replicated. So if you win the lottery or get stranded on a beautiful island, then you want to make sure that someone else can do the job that you were doing while you were um, retiring or absent from the organization. So make sure that your systems are written and that they're written in a way that can be replicated. I'm going to give you some examples of some systems. Um, they are all over the place. The thing that the systems have in common is that they are written down so other people can see them and use those systems. So they can be plans, quality plans, hiring plans, strategic plans, people's support plans, policies, procedures. Let's not forget about training curriculum and what happens during those trainings. So it could be a slide deck, or it could be, a list of trainings that everyone has to do. It can be several different things. Process maps. These are becoming a little more popular because usually process maps are very accessible. You can also, a decision tree can also be a system. Completed assessments and evaluations is something that we look for, and making sure that those assessments and evaluations are being carried out consistently throughout the organization. Meeting minutes, all kinds of different things as long as they are in writing or, as in a process map may just be drawn.
Thank you, Kate. So, what is a system as it relates to the basic assurances? Well, what we want to do is, we've talked a little bit, like Kate, finished us off with robust, sustainable, and reliable. And that's what a strong system in general should look like. And then Kate also shared some examples of what might be considered a system as it relates to service provision. So we have decided on 5 indicators within the basic assurances to discuss specifically what those systems look like in those areas. And we're going to start with indicator 2B. This is found under factor 2, dignity and respect. Now, indicator 2B relates specifically to respecting people's concerns and responding to those concerns. It's essentially about how people receiving services are provided supports to freely express satisfaction, dissatisfaction, concerns, and complaints about their services and supports. It is also about how that input then is responded to by the organization and how the information is used for person-centered planning, quality assurance, and quality improvement efforts. Now, based on the probes found within this indicator, some examples of what CQL would look for relative to a system being in place include some of the bullet points on the screen. I want to start with policy and procedure, okay? Because your policy and your procedure is going to map out what the entire process looks like from beginning to end. So from beginning to end, what is the process for a person you support to report a complaint? What is the process for someone you support to provide input into their services? Okay. What needs to be done? What process do they need to follow? What forms might they use? What other methods might they be able to use to express these things? And then what happens to that information? The policy and procedure might include, like Kate talked about, a process map. Okay, something that easily shows how to report a concern or a complaint or express satisfaction or dissatisfaction or just provide input into what is going on at the organization. Okay, a process map is a lot of times much more visual. It takes the nitty gritty of that policy and procedure, sometimes the more legalese or regulation type verbiage, and puts it into a much more simple map that people can start from beginning and work through to the end to understand what that system looks like. This might also include concern forms. So part of what might be noted in the policy, procedure, or process map might be a specific kind of form that's used, that people would use to report a concern or a complaint or a suggestion. Okay. This might be a written form, a piece of paper, but it also might be an email address, a phone hotline, a button on the website that people can click and get onto to express that concern, a QR code on a poster. There are lots of different things it might look like, but that is another example of part of the system in 2B. Another part of that system, because we always want to close the loop, is not just the method for how people can express satisfaction, concerns, complaints, or just sharing of information, but how is the organization then tracking that? How is an organization keeping its eye on that to understand the information that is being communicated from the people receiving services? And this might be done through a tracking log. Okay, so a tracking log is another part of the system in this indicator. How is that history of concerns or complaints maintained? Okay, and who maintains it? And how do they maintain it? Okay, how often and by whom is it checked for responsiveness and that people got the resolution that they were looking for if there was a problem or something that needed to be resolved? How was that information used? Another type of system, part of the system in this area, are satisfaction surveys or focus groups. So while there might be concern forms that people might use to express concerns, complaints, or lack of satisfaction, you might also have a method for just gathering input, which could be through satisfaction surveys or focus groups. Essentially, these are the methods for the ongoing gathering of feedback, good or bad, from people that you support. So what does that look like? And then again, how is the information used to brought about change? The last thing as part of this indicator is the personal outcome measures. And so part of a system within indicator 2B is the procedure for how personal outcome measures are used. Because personal outcome measures are a way to gather feedback and input in how people feel about their life and their services. So what does that procedure look like for how that will be used to gather that information from people? Okay. So that policy and the way that that is used at an organization is also part of the system for indicator 2B. Okay.
Thank you, Elizabeth. That was very informative. So the next system we're going to discuss is under Natural Support Networks, Indicator 3A. Policies and practices facilitate continuity of natural support systems. Often we see this in policy and value statements. Value statements may include information regarding the importance of having family members involved. It could be in board bylaws. We often see that family members are involved in boards of directors. It could also be how natural supports are included in committees and how their input is taken and used by the organization. But it's also about how people are supported to develop and maintain relationships. And that means new relationships, obviously, with the development part, Making sure that people are involved in their communities could be part of that system, so they can encounter new people and maybe develop other relationships. It also includes how people are supported to get in touch with emerging support networks so they can continue to have those relationships that are so important to all of us. They can also be something that probably isn't touched on enough is advocacy training, and how advocacy training can really support the maintenance of natural support systems. If it could teach me about how to stand up for myself, as part of advocacy training. And if my loved ones want something different for my life than I do, then how I can um, take that information to my loved ones who have influence on my decisions. It could also include things about social media, how it's an important part of almost everyone's lives, and how social media can impact someone's relationships. And from maintaining contact to getting reminders about important dates in that person's life, or important happenings in that person's past, and being able to have communication about that. It could also include things like staff training. Not everybody knows how to support someone to build a relationship or to maintain a relationship. People have different values, and staff values may be different than the person's values when it comes to relationships. So, how are agencies training their staff? What does that involve? And how do you ensure that it is being consistently implemented? Another system is the use of the personal outcome measure, specifically around people have people having support networks and that person's level of satisfaction with that support network. Elizabeth.
Hi. Thank you, Kate. Um, just relationships are so important. That's why Kate and I, as we were looking at indicators, 3A became one that we really wanted to talk about because of how often it gets lost, the importance of relationships in people's lives. So thank
Absolutely.
you.
And we all know how important relationships are to every part of our life. You
Absolutely.
know,
Thank you, Kate.
people be safer. Thank you, Elizabeth.
Which takes us into, indicator
Good
4B.
segue.
So this is found under factor 4, protection from abuse, neglect, mistreatment, and exploitation. This indicator is that people are free from abuse, neglect, mistreatment, and exploitation. This indicator relates specifically to exactly what it just says. It's ultimately about how people receiving services are provided education, resources, and supports relative to ANME, or abuse, neglect, mistreatment, and exploitation, and trauma. Okay. So based on the probes found within this indicator, some examples of what CQL would look for relative to a system being in place include some of the things that are on this screen. Number one, policy and procedure. Okay. So a robust policy and procedure in this section describes how people are receiving education on abuse, neglect, mistreatment, and exploitation. So how are they being supported to understand what these things are or what they might look like in a person's life? Okay. The policy will also describe how the people receiving services are supported to report allegations. So if they see any of those things happening that they've been educated on, how are they then supported to report those allegations? And do they always have to go through a staff? Can they dial the number to the external reporting entity on their own? If they don't use a phone, then what's the process to support them? Is there screening of allegations, or are they all taken seriously and reported? So what is the process for how people are supported to report any allegations of what they feel might be abuse, neglect, mistreatment, or exploitation? And then also in policy, it should describe how people are taught to protect themselves. It's not just enough to know the definitions and what those things look like and how they're supported to report them, but then how are people supported to protect themselves from it happening again, or hopefully from ever happening? What are they taught to do? What are they taught to look for? Are they taught self-defense? Are they taught how to protect their money? What are those things that they are taught to protect themselves against these things? Are they taught how to advocate for themselves, like Kate talked about in the last indicator? Another part of the policy and procedure might be, how or what supports are provided to people if or when any of these things might have occurred. So, what is the process for identifying the needs and wants of people who have maybe been subjected to these things? And then, what is the process for obtaining support for them? So, which could include therapy or counseling or whatever it might be, whatever the person requests to help them with victim supports, with coping and understanding and kind of working through what they're dealing with trauma that accompanies or can accompany abuse, neglect, mistreatment, and exploitation. So then what is the process for that? How is the organization identifying what it is that people need and want if these things happen, and then helping them get the support they need? Another part of this is training and curriculum and resources for people. A lot of times we will talk about having a resource library, because when we talked about people receiving services that are getting education in this area, everybody's learning differently. Everybody's learning styles are different. Some people learn much quicker than others. It takes a little bit longer. And there's a lot when it comes to the different types of abuse, different types of neglect, mistreatment, and then different types of exploitation. So we're looking for a resource library, not just one piece of paper handed to someone once a year that tells them what the regulatory definitions are. That's not a robust system. So we're looking for a variety of educational tools in different formats that are accessible, that really meet the needs of a wide variety of learning styles and needs. So that resource library, that training curriculum, those things that are used to support people, that's another part of the system in this area. Okay, so going back just briefly before I turn this back over to Kate, when we talk about the policy and procedure, within that, we're talking about those victim supports as it relates to ANME and then trauma. This includes prior to entering services, during the receipt of services, and potentially from other people receiving services, which is often referred to as peer-to-peer. So the system or the procedure should outline how all those things are dealt with, how they're identified, and then how people are getting the supports that they need.
Thank you. The next indicator we're going to talk about is under best possible health, and it is 5B, people access quality health care. So when you're looking at your policy and procedures around accessing quality health care, make sure that it is robust. So this means that it describes how people access healthcare, which could be around evaluations, best practices when it comes to um, appointments and, excuse me, testing. And here, when we're talking about healthcare, we're talking about wellness also. So it's not just physical health, but it's also mental health, emotional health, all of those factors that could fall under health. You want to make sure, it's very, very important to make sure that your healthcare policies are very current. If we think about all of the changes that happened as we learned more about the coronavirus and how often you had to change a system because of what new information the CDC was putting out, that's a great example of the importance of keeping a policy very current. It's okay to hyperlink or reference reliable websites when you are talking about a policy, when you're describing those procedures and policy. You also should keep in mind the ethnicity and the kind of those nuanced demographics about a person. So according to the CDC, some of those demographics that we should keep in mind when writing health policies are age, gender, cultural background, socioeconomic status, which is not something that we can always remember to include, the stability or the transient nature of a population, because that will make a difference on, some diseases and transmission and things like that. And also, you want to make sure that you include some family history when you're supporting people by writing this policy. So some of the things that you may think about, some obvious things are, there are certain age groups where certain health tests are recommended. So making sure that those are noted. There are, like over the age of 50, you get a colonoscopy. And over, men have to have prostate exams over a certain age. Those things like that that are considered best practice. You can also make sure that you're listening to the doctor's recommendation, as long as they're in the best interest of the person. And I say that because I have experienced some doctors not necessarily keeping the best interest of the person at the forefront. So, making sure that they align with best practices. So some of the places you can look to for guidance for best practice in the United States are the CDC, the American Cancer Society, the American Medical Association, the National Institutes of Health, medical professional groups like that. You can certainly take a look at their recommendations. Another system is in the person's medical records. And, that could be through the patient portal that some practices have. It could also be through the record that if the agency, is responsible for supporting people with their health, then, it could be in that agency's records. It can be documentation of labs, documentation of different assessments that someone has. But I think it's important to include how someone can access their electronic health record and the importance of that being a system for people to know more about their healthcare and to be able to access information from those records. It could also, another system is staff training. How do staff support a person during an appointment or during a health situation if they need support? And it's also, of course, educating people receiving services about quality healthcare and about assessments and evaluations that may be recommended and helping them understand those if that is necessary. Elizabeth, would you like to add anything?
No, I think that you covered that one quite well, Catherine. So thank you.
Off to you.
Thank you. I think it's the health portal that many of us have through our own clinics or hospital systems that we tend to forget about, that could be part of that system for accessing quality health care.
Absolutely.
Yeah. Okay, so we're going to move on to the last area as far as basic assurances indicators and examples of system. We're going to take a look at factor 7, which is staff resources and supports, at indicator 7B, which is the organization implements an ongoing staff development program. This is one of my favorite areas as it speaks to staff development. So the first thing I always like to talk about with this area is, well, really, what is the robust nature of this indicator? And first and foremost, it's always that, being handed a piece of paper and told to read and sign and calling that training is not robust. Okay. So, not many people, if very many people, learn best that way in all areas of their life. Okay. So that is not training. Okay. So the system might start, as it usually does with training, from a regulatory place. But in order to be robust and sustainable, it has to go far, far beyond that. Okay. So when you look at the probes of 7B, if you're familiar with the basic assurances, or happen to have your manual with you, and I'm on page 32, some of the very first things that we're looking at is, does the program or the training system ensure effective, efficient, and competent staff performance? Okay. It can only be robust, it can only be reliable, it can only be effective if those things are occurring. Okay. Uh, and in other words, does onboarding training set employees up to be successful in their work? Okay. And then does the ongoing training continue that and help staff, all staff, not just direct support staff, but all staff, help them get better at their job? Because it's not just about maintaining, it's also about updating and improving staff competency and staff performance to do the very best that they can do to support people. So when it comes to systems, first, of course, we're looking at policy and procedure. Is there a policy in place that outlines the staff training requirements? Okay. Not just the regulatory requirements, but agency requirements. Okay. So does that policy, does that procedure talk about what the onboarding looks like for new employees? Does it also speak to the ongoing training that all employees receive? Okay, so this might also, in addition to what everybody gets as a refresher once a year or every couple of years or quarterly, but it also might include things like if you have agency nurses, what are their requirements to maintain their license to keep on going at the agency? Okay, so it's about what everybody needs in their position for that effective, efficient, and competent staff performance. Okay, but that policy and that procedure should outline what that entire system looks like for both onboarding and on an ongoing basis. It should also speak to, external continuing education, any kind of, college classes or any kind of external things that an organization is willing to pay for an employee, and what that process might look for the employee to make that request for the agency to pay for it. Secondly, of course, as a part of this is the training curriculum. What is the method of training? What does that look like? Is it online? Is it virtual? Is it classroom? Is it on the job? Is it a variety of these things? What does that look like? How people receive their training? Employee files is part of that system. How is the evidence of that training maintained? Right? So employee files or training files, sometimes they're separated, should show evidence of the training provided and the different methods of how it was provided. What did people receive their training on? What was the topic? What were the main points of that training? Okay? How long was the training and when did they receive it? If there was any competency exams or checks for competency in any way, how is that indicated in a person's file? And then also as part of the system, we're looking for, training feedback. It's how does an agency have a process for obtaining feedback on training so that they understand how it's working for people, and then, but also getting ideas for future training that employees need and want. So there should, as part of this system, be a system for obtaining feedback on the training that employees are receiving. Okay. A lot going on in this area. So very important that we set staff up, set the employees up to be successful in their jobs so that they can support people receiving services in a very robust and effective manner. So now, how do we get started on all this? I know it might seem like we're going a little bit backwards on this, but we really want to talk now about how you can get started creating these systems and what are some of those variables that organizations think about when starting to create or update systems. This is, in order for any system to be sustainable, there must be a method for checking in on that system to ensure it still is meeting organizational need. Sometimes tweaks or even full-blown changes need to be made so that an organization can continue and that system can continue to be robust, sustainable, and reliable. Now, a good way to do this is to follow Edward Deming's PDCA cycle, or Plan, Do, Check, Act. It's also known as the PDSA cycle, Plan, Do, Study, Act. Okay? This is a four-step process for quality improvement. In the first step, which is plan, okay, a way to affect improvement is developed. In the second step, the do, the plan is carried out. And then in that third step, check, a study takes place between what was predicted and what was observed in the previous step. In the last step, which is the act, action should be taken to correct or improve the process. So let's take the PDCA and let's apply it to one of the indicators and what that might look like. So if we look back to our last slide where we talked about staff development, as a provider, you might create a system for how onboarding training looks. Okay? That's your plan. Okay? You might use a short training feedback form to understand people's thoughts about the training they receive. That's the do. That feedback might tell you that new staff aren't connecting what they learned to the work that they are doing. That's the monitor, the plan, do, the checking part of it. Okay. So as an organization, you act or improve on that information by adding on the job hours in between classroom and online training. That's the plan, do, check, act. It's putting the system in place, putting the policy into place, putting the, in this case, the training feedback form into place to obtain the information, to learn about it, and then to take that and implement a new way of doing things to correct any gaps that you are seeing. Okay, that is plan, do, check, act. And this should be done with every system on a regular basis. And we aren't saying every day or even every month, but there should be a system, okay, that keeps an eye on all of this. So Kate will then tell you kind of where some of these things might stem from.
Absolutely. That was great advice, Elizabeth. Thank you. So, when we talk about getting started with a system, a lot of times the first place we need to start is the regulation. Okay. And these are typically the minimum standards required to operate. So, and a lot of things are regulated. Obviously, as a provider, you have state regulations, there are federal regulations, You may even have local things that you have to do. So a lot of times what we see is those things that are heavily monitored, HR policies. There are a lot of rules and regulations around that, that are federal. You also have, state regulations on where to report abuse and neglect, just for an example. There could be local regulations around, how many people that are unrelated can live under one roof. You can have zoning regulations that, apply to you, residential versus commercial, those types of things when you're talking about zoning regulations. So you have to make sure that you're familiar with those and that you are abiding by the laws. The other thing, you're really kind of your next step to make sure that you are writing a policy or implementing a system that is robust, sustainable, and reliable is to research. What are those best practices around best possible health? What are those best practices around teaching people to advocate? Looking at those to inform your policy so you have a system in place to be able to do those things. Also, talk to other providers. I mean, one of the things that we love to do at CQL is connect agencies and, with each other so they can learn from each other and so they can get information from each other so they're not recreating the wheel. Now, what we are not saying is to, plagiarize someone's policies and just slap your name on it and say it's yours, because that doesn't work. Next slide, please. So we're going to talk a little bit more about what doesn't work here in a second. When we're talking about the use of consultants and, buying things. Some of the best practices that you'll definitely want to look at are obviously the basic assurances and the personal outcome measures. When we're looking at systems, we're comparing them to the basic assurances and to the personal outcome measures. You can also look at scholarly articles. There's a gazillion on our website. If you want to look at some best practices, we have a lot of research that we have done. We also have capstone articles and all kinds of things like that. You could also just, Google something or look it up on the internet and see what you can find there. You should certainly, when you're setting your systems in place, you should certainly look to subject matter experts, which includes families, DSPs, people with lived experience. Talk to the people who really know what is going on and what may work best. You can also look at professional associations. These can be, like we talked about under the 5B, we talked about the American Medical Association, places like that. But there are also other professional associations, social work and even different therapies. Also provider associations. That's a great place to network with other agencies that provide the same types of services that you may provide. One of the things that comes up often is when an agency uses a consultant to write their systems, especially when it comes to writing policies. We just ask you to be wary of that and to ensure that if you're buying a policy, that's ready made, an HR policy, a finance policy, especially when it comes to those things that are just federally or locally governed, that they are what they are. Those policies are probably a little bit safer if you're going to look for a ready-made policy. What may not be is a rights policy or a dignity and respect policy, something like that. You want to make sure that when you're researching and you're getting information from similar organizations, that you make sure that it applies to your agency. So I could give you a million examples of, agencies that have job descriptions where that position doesn't even exist within the agency, or there's a very lengthy system around incident management that doesn't apply to the agency because they don't provide certain services. So just be wary and rely on us. That's what we're here for. When you're connected to your QES and ask them questions. That is something that we always say, ask us and we will support you, or we'll put you in contact with someone who does a really good job with certain systems that they put in place. Next slide, please. So we're going to talk a little bit about how we can sustain our policies, a little bit more actually. As Elizabeth talked about, routinely go back and assess the effectiveness of a policy and make sure that it's still accurate. So it's, up to date. Know what's happening in practice. If a practice is not matching a system, then you need to take a look to find out why. That's again when you pull in those experts within the organization, to ask them if a DSP is not doing something the way in which they were trained, then what can you do? Where's the glitch there? How do you fix that system so it matches your practice, especially if your practice is better than your system? Make sure that your systems to be sustainable are responsive to the changes in the field. In my 20 plus years of experience in the field, there are lots and lots and lots and lots of changes that have occurred. So it's your responsibility to make sure that your systems are keeping up with the changes in the field. And of course, we want you to be responsive to the changing needs of the people receiving services. So next, we're going to talk about when you need to know when a change is needed. And as I alluded to in the last slide, your system and practice simply don't match. Okay. But it's also part of that being responsive when people are asking for a change. And my favorite one, which is, why do we do it this way? Or why do we have it this way? And no one knows the answer. That's a definite sign to take a look at that policy. Another definite sign is when you say, well, we've always done it that way. That's another very good reason to look at changing a policy. And then if there are key changes in the organizational structure. So if you've had some transitioning in key positions within the agency, if there's been a lot of growth, or if there's been, a change in services, whether they're new service lines or you're updating current service lines, things like that. So these are some resources and that you can sign up for. We can make sure you take a look in the chat box where Seth has input a lot of resources that you can check to see. But now I think Elizabeth and I are going to answer some of your questions that are in the question box. One of them is, what is CQL's connection to CMS DHS pending mandates? And make sure that, I want to make sure that everybody knows that the personal outcome measures is included in the CMS HCBS quality measure set. And you can learn more about that on our website. I will discuss a little bit, are doctor's orders to be followed as directed, or are they just recommendations? Depends on the order and the person's preferences. We are not going to tell you not to follow a doctor's order. That is not our decision. We are not going to tell you that you must follow a doctor's order because that's not our decision either. So what we recommend doing is talking to the person and making sure that it has been communicated and described to them what the pros and cons to that doctor's order are. And also, you might need to investigate why a particular doctor's order was written. Is it because it really is, a best practice for the person to keep themselves healthy? Or is it because the guardian may have an opinion about something that they think the person should do? And the doctor, writes the order to kind of make it official.
And this might, going on what Kate said too, this might be when it comes to the indicator Kate talked about in best possible health. This might be part of the system is to have some sort of form or document that speaks to risk versus benefits. So if a person is choosing not to follow something a doctor recommended, it is clearly kind of noted that the information, both the risk versus the benefits of following that order or not following that order, have been communicated, so the person has truly made an informed decision. And sometimes that's also needed with guardians and family members as they are assisting in supporting decision making in regards to health as well. So,
Absolutely. And I understand too. I mean, I worked as a provider for many years before coming to CQL, and it's the liability that agencies have to or may have to face if a doctor's order isn't followed. For instance, if someone is has high blood pressure, but they love high salt foods, so the doctor says low salt diet, and the person says no, I want my potato chips or whatever it is that they prefer to have for their salt intake. So you have to educate and make sure that the person is understanding what the pros and cons of that doctor's order are.
another question that came through too was someone asking to talk a bit more about surveys. Are there standard surveys utilized or individually created? And it's kind of a broad question, not completely understanding what types of surveys are being asked about here. If referring to satisfaction surveys for people receiving services, each organization tends to create something that works for them based on the information that they're wanting to learn. It's great to have them in an accessible format so that people can answer them. They can do them on their own, so they can feel free to have a little privacy in how they answer, maybe answer a little more truthfully than if their staff are helping them. So there might be picture formats, online formats, just a number of different ways those are used. But there are different organizations that use different ones. And then the other one it could be is in regards to staff training. Um, as a provider that I work for, like Catherine, for many years before coming to CQL, we kind of created our own just status or surveys, feedback forms that staff could complete upon the end of every training. And it pretty much just asked two simple questions around the content of the training and the presentation, what they liked and what they could get better or what they felt could get better. And so it's very simple because, when people are done training, they don't want to stick around. They're ready to go. So we always want to keep it short. So, but even though they were short, they provided tremendous information to continually just enhancing the training that was offered both during onboarding and on an ongoing basis. So that was very much individually created by each trainer or by the organization. So that's the best. I hope I answered it. If not, then here are Kate and I's email addresses. You can feel free to reach out and we can chat a little bit more if there's more you want to know, or if even you're looking for an example of something, I'm sure there's something that I can locate that we can share. So.
And just to add to that, Elizabeth, just like we talked about, as surveys can be a system, make sure that you're taking a look at those surveys so they don't get stale and they're still telling you the information that you need to know and that you want to know. So feel free to mix those surveys up because you could want specific information for a certain period of time, and then you may need to look at something else. So make sure that you are keeping those fresh. So you're getting information. Of course, you're going to want to keep some core elements of that survey because you want to be able to track that data perhaps and see how you've done. So keep that in mind too.
Okay, looks like the one that was requested was around staff training. So hopefully, Rachel, that answered kind of what you were looking for. It wasn't, say, individualized based on the different training. So like each training didn't have their own individual survey about the training. It was pretty much always the same three questions. It might look a little bit different if it were a virtual or online training versus maybe classroom or on the job. That might be where there's a slight difference in maybe a question asked, but it's never a lot of questions. It's always kept very short and simple, just to find out, you know, if the content is helping, if there's anything missing, anything you'd like to see different. And then of course the modality. As we know, some people learn best in the classroom, others learn great through online means or virtual meetings, and yet others need a hybrid approach of classroom, on the job, virtual, and online training, depending on what the topic is. So hopefully that helped. But again, feel free to reach out to either Catherine or I using the emails that are on the screen.
Absolutely. So thank you, everyone. I don't think we have any other questions that are pending. As you know, as Elizabeth has stated, feel free to reach out to us. We also have a lot of information on our website if you want additional information regarding policies and other systems that you may want to write. Seth has put a lot of links in the chat box, so feel free to use those. And also, please connect with us. The Facebook group seems to be going very well, and that's where a lot of people share ideas. So that's a great resource for you. And feel free to sign up for that.